5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. If you have any questions or ideas for topics you would like me to cover, please get in contact with me on social media using the handle Diary of a Kidney Warrior. In today's episode, I am bringing you a kidney warrior story. Now, there's always something you can learn from someone's story, something that can bring inspiration and hope. My guest today from Cheshire, England, is Customer Service Executive Rachel Stewart. Rachel is passionate about sharing her experiences of CKD and sepsis in the hopes that it may help to save lives and inspire others going through difficult times. Rachel joins me to share her kidney warrior and sepsis story and the lessons she has learned along her kidney warrior journey. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Rachel?
Yeah, I'm good, thank you. Thank you for having me.
You're very welcome. Welcome to the podcast. Everybody knows what I'm about to say because I say it every time, but I sincerely do mean it when I say I'm always excited to record Kidney Warrior story interviews because, as I say each time, and it is so true, it is so powerful to learn from someone's lived experience with CKD. So yeah, I'm really excited. So today we're going to be talking about CKD and we're also going to be talking about sepsis. So we're going to be covering the two topics today in this episode. So without further ado, I'm going to start with my first question. And my first question is, how did your kidney warrior journey begin and how were you diagnosed?
So I was diagnosed as a type 1 diabetic when I was about 10 years old. So I was quite unwell for about 6 weeks when I was a child, where I was exceptionally thirsty all the time, going to the toilet a lot more than usual. I was very sleepy. I lost a lot of weight. I lost about 2 stone, which obviously is quite a lot for a child to lose. So obviously that set alarm bells ringing. And yeah, I was diagnosed as a type 1 diabetic. So when I first went in, I think they were quite surprised that I was still sort of walking around and hadn't been admitted to hospital because my blood sugar was 32, really high ketones, which can make you seriously unwell. So yeah, lucky that was caught when it was. And then, yeah, it was challenging being a type 1 diabetic, being a child and going through your teenage years. And yeah, I did struggle to manage it when I was a teenager. I think that's quite common. But that sort of improved as I went into adulthood. I managed to get a better grip on it. And then there isn't really much else to say about my diabetes, really. That's just been, ticking away in the background. And then sort of from my early 20s, I suffered with some quite serious kidney infections, some of which were sort of treated at home. But a lot of the time I was admitted into hospital with kidney infections, needing stronger IV antibiotics. And that happened quite a few times. And I had sort of basic investigations, really, if I was ever admitted to hospital with urology, to see if there was any sort of issues with tubes in the bladder and things like that. And nothing was ever really picked up on, nothing was ever found. So they were just treated as normal. And once I was better, I went home. That'd be the end of it. Until I got quite a serious infection then in August of 2021, where I was in hospital for a couple of weeks. And there was talk at the time of me having an acute kidney injury when I was admitted that time. That was the first time I'd heard that. I wasn't aware of really what that meant, sort of given a leaflet and things. And yeah, it wasn't really explained to me that well. But after that, I was still looked after by the diabetic team, but referred to the renal team. But there was quite a big backlog because of COVID. So once I was discharged in the August, I wasn't given an appointment with the renal team until January of the following year. So I had about 5 months where I was sort of in the community, and the sort of diabetic consultants were doing their best to sort of manage me in the community, but I was very unwell. I was having blood transfusions. I was very anemic. I had terrible swelling sort of in my feet and my ankles and my lower legs, to the point where it was sort of affecting my mobility. I was so anemic that I was really struggling to walk, up and down the stairs without feeling really breathless. And that was really challenging and a really confusing time as well, because nobody's giving you the information. You don't understand. You know that something's wrong, but you don't understand what it is and how serious it is. And, even the diabetic doctors were talking about, I think you should limit your fluid intake. And I was thinking, why would I need to limit my fluid intake? Surely I should be drinking everything, because I had no idea about CKD and kidney issues or anything like that. So yeah, it was just a really challenging and confusing time, really, up until the point when I then got my appointment in the January of 2022 with the renal team. And the main thing that I remember from that appointment is being sat down by the consultant, and he told me that I had kidney disease. And he just said, "And I can't make you better." And after that, I think I just sort of shut down. Luckily, I'd taken my mum with me. So my mum was out with a pad of paper and a pen, writing everything down and asking all the questions and everything. And at that stage, when I was actually diagnosed, and the first time that I saw the renal team, I was already at stage 4. And the plan was really just to throw a load of medication at me and see you in, I can't remember the gap between the appointments now. I think it was it every month? Might have been every 4 weeks, maybe, at that stage, and regular blood tests.
Rewinding slightly, because I really am shocked that the doctor would actually say something like that. But your doctor said to you that I can't make you better. So you had to wait several months without any renal input to then, when you actually do see the renal team, the first thing you're told is, I can't make you better. So it's at a late stage. I mean, to find out at stage 4, I mean, that must have been devastating. What was your understanding of that at the time? Did you know what that meant? I mean, what were you going through at that time?
Yeah, so, I mean, it was really, really challenging. One, because I was so unwell. I didn't understand what was happening to me. I had no knowledge. And I think after that sort of first sort of few minutes of that appointment, like I say, you get that news, you just sort of completely shut down then. You're not hearing anything else that's being said. And I am quite an anxious person anyway, and I have been since I was a teenager. But I found it very challenging then to also get the information and the knowledge that I needed in a way that wouldn't make me feel more anxious. So yeah, it was just really difficult.
So following on from what you were saying about feeling anxious and needing information in a way that didn't add to those feelings of being anxious, how do you need that information shared with you to help with that? I mean, for people listening who also have difficulty with anxiousness, what do you think would actually help to make that easier?
I think for me, I had to be quite strict with myself about the times that I would look at information. So I'd have to sort of check in with myself prior to, having a look at any information or wanting to gain any knowledge, to make sure that I was in the mindset that I could cope and not go down a rabbit hole and spiral into some pit of despair. And the other thing that I was very, very conscious of was making sure that the information that I was getting it from reputable sources, from official sources. So especially Kidney Care UK, the information that they put out there, they've got loads and loads of information on all sorts of topics, and it's given to you in a sort of safe and calm manner. It's not going to evoke feelings of like major panic and anxiety. So those are the things that I did to try and help myself.
You've now got this diagnosis of stage 4 kidney disease. What happened next?
So I went away and sort of started trying to process, like I say, what that meant. And really, looking back on it now, I just needed to give myself time because, feeling sad, anxious, upset, and all those sorts of things after that sort of news is a completely normal reaction. And I think at some points it was quite hard on myself to think that I wasn't coping and I should be doing better, X, Y, and Z. And so just giving myself that time to process and feel all those feelings as well. And then, unfortunately, about 3 or 4 weeks later, after my appointment, I had felt unwell for a couple of days, just sort of generally under the weather, nothing that I could really put my finger on, just feeling sort of generally unwell. But again, with my kidney issues, that wasn't something that was unusual to me. Then I woke up at about 3 a.m. one morning and I had some sort of pain in my back around my kidney area. Again, that wasn't particularly concerning to me. It was something that I'd had lots of times before. So I'd got up and got myself some paracetamol and a hot water bottle from downstairs, and I went and got back in bed. And I just thought, I really just don't feel right at all. And I woke my partner up and said I didn't feel well. He's sort of quite hypervigilant around me and my health. And he was sort of like, oh God, do you need to go and see the doctor? Do you need to go to hospital? I said, no, I'm okay. But very quickly, I just went downhill. And within sort of 45 minutes, I was in the car and I was struggling to sort of even hold myself up because I felt so dizzy and breathless. I was being sick in the car. I was having to pull the car over on the way to the hospital. I was in a lot of pain. And by the time we got to the hospital, we'd actually had to park the car about 1 million miles away from the A&E department. I said, I just need to get into that department as soon as I can. And I got out the car. I took about 2 steps and I said, I can't do it. So we had to drive around to the A&E anyway and pull up like right outside so we could actually get inside. And as I got to the desk and I was trying to give them my name, I just collapsed on the floor. But one of the things I did say to them, because in the August of 21, when I'd been poorly before, I had sepsis and it felt a little bit similar. And I did say to them just before I collapsed, I said, I've had sepsis before and it feels similar. And obviously we'll come to this further down the line, but I think that's one of the things that actually did probably end up saving my life in the end. So after I collapsed, I was taken through obviously sort of straight away into the majors department. And to be honest, after that, all the details get a little bit sketchy because I was just so unwell and I was sort of in and out of consciousness for the majority of the time. I was in A&E for about 18 hours in total. And during that time, obviously they were doing observations and things and did a CT scan, and I was seen by various teams. So I was seen by urology and various different consultants. And I just deteriorated basically. They were giving me sort of fluids and antibiotics and things, but I carried on declining. And it got to the point where my blood pressure was really seriously low and my body was just struggling to keep my blood pressure up at all. So they had sent a consultant from the ICU department to come and review me in A&E. But at that time, it was decided I wasn't poorly enough to be admitted into ICU and that they should try and start resuscitation attempts within A&E. So I was really shocked when they told me that afterwards. But when they talk about resuscitation, doesn't necessarily mean that somebody's giving you CPR. So in my case, resuscitation meant that they were giving me lots of medications to try and support my blood pressure and get my blood pressure up and filling me full of fluid as well. So if someone has low blood pressure and you give them fluid, it's supposed to up their blood pressure. But unfortunately, after a few hours of trying, it just wasn't really going anywhere. It was just deteriorating. So I was eventually admitted into ICU. And then when we were at ICU, initially I was on oxygen therapy. That was partly because they'd filled me with so much fluid in an attempt to get my blood pressure up, but because my kidneys had failed at that point, I wasn't getting rid of any of that fluid naturally. So that then filled my lungs and I was obviously struggling to breathe. So I needed oxygen therapy. And I was then also put onto kidney replacement therapy within ICU, which is similar to hemodialysis, but it's slightly different when you're in ICU. So if you're classed as being unstable when you're in ICU because you are poorly, they put you on this kidney replacement therapy because it's kinder on the heart. So it works similar to hemodialysis, but it doesn't put as much strain on the heart. So it's continuous. So you're sort of on the machine for a few days at a time. Like I was on, I think, 48, 72 hours, something like that. And it's just continuous where they're just filtering your blood all the time. So it's just kinder to your body. It doesn't put as much stress on the heart. I was on various medications for my blood pressure, lots of steroids and antibiotics and things to try and fight off the sepsis. And so it was then confirmed to me that I had gone into septic shock when I was very unwell. And I know now I'd obviously heard of sepsis, but I hadn't heard of septic shock. And it has a really high mortality rate. So I'm very, very lucky to still be here today.
So for people who don't know, what is sepsis and sepsis shock? Yeah,
so sepsis is the body's overwhelming reaction to an infection. So the infection can come from anywhere. And it's the body trying to fight off an infection, basically. And it can make you very, very unwell. The main symptoms are having a really high temperature, but feeling very cold, having mottled, sort of purpley looking skin, feeling very breathless, feeling confused and slurred speech. And it can make you very unwell. And it's similar to septicemia. So it's an infection of the blood. So then it affects your entire body. Septic shock is the next stage after somebody develops sepsis, where your body goes into shock because of the sepsis. And that has, I can't actually remember, I think it's around a 50% mortality rate. So
Wow.
It's, not a nice thing to go through.
So you were seriously, seriously ill in the ICU, having continual kidney therapy and fighting for your life. To hear how serious sepsis is and that it has such a high mortality rate really shows the battle that you fought to still be here. So how long were you in the ICU for?
So I was in the ICU for 2.5 weeks in total. And during that time, like I say, I was on the continuous kidney replacement therapy and I was having blood transfusions and all sorts of things. And then after I finished in ICU, I was then transferred to another hospital, to a renal ward, and I stayed there for 3 weeks.
So am I right in thinking then that the sepsis then put you into kidney failure and therefore you would need to go on to dialysis?
So it wasn't quite as quick as that. So the sepsis did knock my kidney function off quite quickly, but luckily I didn't have to go on to dialysis sort of straight after. So I was diagnosed at the end of March and I had over 12 months then prior to reaching the point where I did need to start dialysis. And then, I had to have my PD catheter inserted in July of last year.
So how was the period of time from leaving ICU until getting to the point of needing dialysis? Were you hoping to maintain your kidney function, or did they say to you, it's going to decline and expect to end up on dialysis? What was the thinking around that time?
So everything was very sort of uncertain and there was no real answers, to be honest. I mean, it wasn't the fault of anybody. I think it was the fact that my kidneys had been affected by the sepsis. And because of that, we couldn't really work out any pattern as to how long my kidneys might last before needing to go on to dialysis. And yeah, it was really tough. I mean, I think when I was in ICU and when I was in hospital, nothing really hit me. I think I probably was in a state of shock for quite a long time. And I sort of just went into this fight or flight type state where my only goal was to get better and get home. I just wanted to get better, get home. And I didn't think about anything else. And then it was once I actually got home that things were less challenging physically, but much more challenging mentally, because that then started to catch up with me. So yeah, during that period, like I say, it was just really uncertain. I didn't have much input in terms of my mental health. Somehow, I think they explained after I'd been discharged that usually if you've been into ICU, you get like a follow-up appointment to go in and chat about it, and you can ask questions and things like that. But I was missed off the list because I was transferred over to a new hospital. So I actually approached the hospital that I'd stayed in ICU with, and I said, look, I've got questions. And because I'd been so unwell, my memory was very hazy. And I personally needed those answers to understand what had happened to me, because I felt like I didn't understand. So I approached them and I said, is there any way that I can talk to someone and just get some information about my stay or get the notes or whatever? So they apologized and said, you can come in, you can come and see us. So I did go in and I saw the care coordinator from the ICU department, and she was absolutely amazing. She took me into the unit and I met some of the nurses, and I saw the bay that I stayed in, and it wasn't upsetting, but it did trigger emotions, obviously, because it was emotional. And I explained, that I've got so many gaps in my memory, I don't really understand. So she said what they usually do is, because obviously they have a lot of patients that are on ventilators when they're in ICU. And what they do for those patients is they write diaries for them so that when they come off their ventilator, they can read it and they can see everything that's happened during that period, which is really good. And I explained, well, I don't have memories of how everything fits together. And, I had random bits here and random bits there, but nothing that flowed in a logical way for me to make any sense of it. So she actually went back and spoke to the people who cared for me and looked over my notes and created this diary for me, which was amazing because it just helped so much. And I think they've actually changed the procedure now where any patient that goes into ICU, they do the diary for, because they said to me that you seemed really compos mentis and you were having conversations and, you were awake, but I wasn't really there. It was, there was nobody at home during that time. So yeah, that really helped. And then we talked about any sort of symptoms that I'd had since I'd come out of ICU. And she talked to me about post-sepsis syndrome, which I'd never heard of. And she explained to me that it can have a wide range of sort of physical and mental effects. And she mentioned to me things that I had been experiencing, which was sort of things like brain fog, hair loss, mobility issues, just general sort of fatigue and things like that. And I just sort of, well, for one, because I've been having issues with feeling so anxious and things, I didn't know whether I was just having some sort of like crisis. And when I discussed that with her, it really opened my eyes that you're not losing your marbles. This is a normal reaction and it's something that other people experience. And she then put me in touch with the Sepsis Trust. And I just found so much information through them about post-sepsis syndrome. And they run support groups where people who have suffered with sepsis or people who have suffered a bereavement because of sepsis, they've lost somebody due to sepsis, they can go and they can talk about all these things and get the support that they need. So they were quite a big lifeline for me as well during that time.
I think it's really important that people are given this information. Having that diary, I think, is amazing. And technically, it was a diary of a kidney warrior.
Hey!
During the time that you were in ICU. And it's interesting because you were talking during that time, so anybody would have thought that everything was fine. But as far as you were concerned, actually, you can't remember that you weren't fully there. So I think sometimes people can present as more well than they really are. And I think as kidney patients, as kidney warriors, certainly as part of having kidney disease, that's one thing that you don't look sick, you look fine kind of thing. But it can also apply in as serious a situation as the ICU. And that's mind-blowing to me that actually you could present that way, but still be so very ill. And for anyone listening who has a family member in the hospital, whether it's ICU or not, it might be helpful to have that diary for them to help fill the gaps in. Because like you said, you don't know what's happened during that time. You've lost so much time whilst you've been ill. And I think that also adds to the distress afterwards, because you're just thinking, what happened to me? What happened during that time? And I think having that tool, having that gift really of that information could make the difference for so many people. So I think it's an amazing idea. And I really hope that more hospitals do that for their patients, even if it's bullet points to say, this day, this happened, whatever. But just having something like that to fill in the gap, I think is really life-changing and amazing. And in terms of what you experienced in post-sepsis syndrome and the impact on your mental health and the difference that made for you, it just goes to show that sometimes it doesn't have to be a really complicated thing. It can be a simple thing like a diary that can make a difference to someone's mental health.
Yeah, absolutely. I mean, like you say, that was a gift that they gave to me, because it did cause me so much distress to have had that period of time that I didn't understand what had happened to me. And, you know, it wouldn't have been a 5-minute job for them to have sat down and done that for me. So the fact that they've taken the time to do that for me is huge, especially when we know how pushed the NHS are anyway. The people that work in that intensive care unit are angels. And yeah, it sounds really strange, but I do remember that fondly, obviously not being so unwell and having to be there, but the way that they took care of me during those 2.5 weeks was just unbelievable.
Did you have any further support with your mental health?
I did. So I tried to speak to my GP about accessing some sort of help. I didn't know what help would be available. They suggested that I self-referred myself to talking therapies, but I was advised that the waiting list was really long, and I didn't know when I would hear. So I also found out through Kidney Care UK that they offer a counselling service. So I got in touch with them. You refer yourself into that service, and then they will call you and give you I think it's like a 20, 30 minute sort of consultation. And if they feel that they would be able to help you, they'll then book you in for 6 sessions with them, a maximum of 6 sessions. And the great thing about the counselling that Kidney Care UK offer is that their therapists are all renal-trained. So you don't have to spend time explaining to someone who's never dealt with renal issues before where you're at in your journey and what that means. And they automatically understand when you tell them pre-dialysis, dialysis, transplant, whatever it is, they understand what that means, and also all the feelings and the emotions that can occur because of that. And I've actually had 2 blocks of counselling with Kidney Care UK. So one was in the period after I'd been discharged from ICU. So after that time, I was suffering with sort of symptoms of PTSD, partly due to, like I said, not having a full understanding of what had happened to me. I also struggled to sort of differentiate how I felt because of my diagnosis of chronic kidney disease. And then because so quickly I'd become very sort of life-threateningly unwell, I tied those 2 things together, and I struggled to understand that the chronic kidney disease wasn't going to end my life imminently. So I found that quite challenging. And I also had sort of flashbacks to things that had happened while I was in ICU that were difficult to deal with, sort of like medical trauma about procedures and things like that I'd had. So I had a block of 6 sessions for them with that, and they had sort of specialist techniques to help people overcome PTSD, which at the time I was a bit skeptical about, but it worked absolute wonders. I still obviously feel anxious and get certain feelings and things like that, but at the time I was sort of getting into bed every night, and as soon as I closed my eyes, I was having these flashbacks and feeling very anxious and upset, and that I managed to stop that, which was obviously a big improvement. And then I also had another block of sessions after I started dialysis last year. So sort of September, October time last year, I had another 6 sessions. And that was really good as well, because it just helps you to discuss and talk through all of your feelings and with someone that understands, because it can be difficult for people who haven't experienced these things to understand what it is that you're going through and how it makes you feel. And I can't speak highly enough of the counsellors from Kidney Care UK, and I understand that it can feel daunting to reach out for help and to talk about the way that you feel. But coming from someone who did feel like that, I didn't really want to do it, but I knew it was necessary, and it has really, really helped. So I would encourage anyone to just reach out and speak to somebody if you feel like that would be beneficial to you.
I echo that 1000%. I really believe that counselling is so beneficial to help you, whatever area of mental health it may be. I think counselling, and like yourself, when I was in my early days of diagnosis, I had counselling from Kidney Care UK, and 1000% agree with you. It makes a massive difference to speak with someone who understands about the condition. You're not taking up time having to explain. Absolutely, it makes all the difference. And so with this in mind, what advice do you have for someone who may be struggling in terms of anxiousness or different struggles with their mental health? What advice do you have for them?
I think, like I said, speaking to people, talking about the things that are going on inside your head is a massive, massive thing. At the end of the day, this disease is challenging. We are called warriors for a reason. And it's okay. It's okay to feel sad, down, depressed, anxious, frustrated, angry. Those are perfectly normal reactions for what you're going through. And I think sometimes you just have to give yourself that time to feel that way. Obviously, it really helps if you have a good support system as well. Try and get, your family and your partner and your friends, if they're interested, to read up a bit about what is going on in your life, because that gives you a good support system. And I think another thing as well that I personally have found important, and it might not be so important for other people, is that just to remember that everybody is different and everybody's journey is going to be different. So I used to get very hung up and anxious when I heard scary things that happened to other people on their journey, and I'd become convinced that that was going to happen to me. And you have to let go of that, because just because something's happened to one person, it doesn't mean that it's going to happen to you as well. And I think just being positive, it's good to have good people around you, but just trying to remain positive just helps immensely as well.
Sometimes people think that being positive, you're in cloud cuckoo land, be positive and everything's all okay. It's definitely deeper and more than that. I don't think anyone is saying, if you're just positive, you're going to be walking on air and everything's going to be fine. But I think it really is the glass half empty, half full type mentality, as I would say, that ability to actually see the silver lining in the clouds. Because if you're just focusing on the clouds, you will go down and down and down and down. But if you can just pick out that aspect of hope, it makes all the difference.
Yeah, I agree.
You had your peritoneal dialysis catheter fitted in July of 2023 and then started peritoneal dialysis in August of 2023. How has peritoneal dialysis been for yourself?
For me, and I'm touching all the wood that I can find, it has been relatively problem-free. I had my catheter, as you say, inserted in July 2023. I think I had about 3 or 4 weeks then before I actually started PD. I went into like a specialist facility to do my training, and that was like a 3-day course that was just like full on, and you stayed over and did your training in that centre. And then I came home and just continued at home. The only issues that I have had is I've discovered that I'm allergic to all sorts of dressings that have caused me problems, which has been an absolute nightmare. But luckily, my nurses have persisted and we found one that does agree with my skin now, so that's okay. The only major drawback for me, which I have struggled with, is the weight gain that I've struggled with since I started PD. That has been a challenge. Yeah, at times I've had big wobbles about that. But I just try and remind myself that it's not, hopefully, forever. And, you know, once I've been able to have my transplant and feel better, hopefully, you know, I can then focus on that being the next thing. But at the moment, we're just focusing on being well and making sure that my dialysis is doing what it should be doing to get me to that point.
Having experienced that myself when I was on PD, the weight gain definitely was something that I had to continuously remind myself, actually, it's not weight, it's water weight. So I think it's so important. If you've got, here's a practical thing. If you have a scale that measures the fat percentage, then you'll know the difference between water weight and actually gaining weight. And so for me, having a scale like that just kept me on the right track. It's like, nope, I haven't gained weight. This is water weight. Don't be so hard on yourself. I just think it's really important that people know that weight gain is an unfortunate side effect to PD, but try not to worry too much about that. And for some people, as they continue PD, the water weight starts coming off. So hopefully, put my hands together, that will be the case for yourself. And so while we're talking practically, do you have any practical advice for somebody who is just starting PD and he's thinking, oh my gosh, what am I going to do?
Having a good setup is really important. So when I first started, my partner, who has been brilliant, and I always sing his praises, and it probably makes him cringe, but that's fine. But made sure that I had a good setup by the side of the bed where I could have all the bits that I need, all my sort of sanitizer and my wipes and things like that. Just making sure that, I think for me, a massive thing was making sure that I did everything by the book, because I knew if I did everything by the book and the way that I'd been taught, that I should be safe. And again, that was really important for my sort of anxiety levels. So I was very, very conscious, because they put the fear of God into you about bacteria and germs and those sorts of things, which again is not good for somebody who is over anxious anyway. But knowing that you're doing everything as you've been told to do it will definitely help with those feelings. I think another thing that I will just mention as well about the tube, when I first had my catheter inserted, I felt like the world was ending. I couldn't look at my tube. I didn't want to touch it. I didn't want to clean it. I didn't want to do anything. And I cried every time I looked in the mirror, because I just felt like my body wasn't my own anymore. I just felt like I'd had this thing put into me and it was horrible and I hated it. But again, that will improve with time. Like now, well, I mean, it probably took maybe a month or so for those feelings to sort of start to subside and for it to become more normal. And now it feels like it'd be weird if it wasn't there. And again, just having the mindset that this is saving your life and keeping you well, allowing you to sort of live a relatively normal-ish, in inverted commas, life. So yeah, I think those would be my tips.
I know that you're active on social media. And so for anyone that wants to follow you, what are your handles?
Yeah, so I have an Instagram page where I post about my journey with having sepsis and CKD and my journey to transplant. So you can follow me, and my handle is transplant.diaries, and diaries is DIARIES.
So repeating that handle again, it's transplant.diaries. And so please do give Rachel a follow and support. Make sure you like and comment and raise the algorithm and give Rachel some support. So you mentioned that your handle is Transplant Diaries, so that would indicate that you are on the transplant list. So let's talk a little bit about that. So when did you become active on the transplant list?
So I started my assessments for transplant in November 2022, and I became active in September 2023. So coming up to 12 months active on the transplant list at the moment. And I've been listed for a simultaneous kidney and pancreas.
So you've been listed for a simultaneous kidney and pancreas transplant?
Yeah, that's right.
So how has the wait for the transplant been for you so far?
To tell you the truth, it's a bit weird because when I remember that I'm on the list, because sometimes I forget, which I think is quite good. When I remember, it's strange because you get feelings of excitement, but also feelings of dread because it's obviously such a big thing to go through. But yeah, the majority of the time, I don't really think about it, which is good because I think if I was thinking about it all the time, it'd feel like I was waiting an eternity. But yeah, it's like strange emotions, feeling sort of excited and terrified all at the same time.
What advice do you have for somebody who's also on the transplant list in terms of being able to cope with that wait?
I think sort of being prepared as much as you possibly can. So I have a go bag that is prepared with lots of things that I can take into the hospital with me that I'll need sort of to just pick up and run as soon as I get that call. Try to live your life as much as you possibly can during the time that you are on the list, because I think a lot of the time I've described it in the past as feeling like I'm almost holding my breath, just sort of waiting. But obviously life still needs to go on during that time. So, still do all the things that are important to you and, as much as you can whilst you're obviously struggling with your CKD journey. And that's it really. I think that's all you can do.
Thank you. That was really, really good advice. What is your final word of encouragement for the listeners?
I think really it's just try as much as you can to be positive. This is challenging. Like I say, we're warriors for a reason, and it's okay to have down days, but having a positive attitude will really just help to pull you through the challenges that you'll go through. I think when I had counselling, one of the things that the renal counsellor said to me is that this is a journey. And when you're on any journey, there are potholes and bumps in the road and they're to be expected. But yeah, positivity, just trying to see the silver lining in situations will always pull you through, I think.
Thank you so much for joining me. Thank you so much for sharing your story of CKD and sepsis. Thank you for sharing such amazing practical advice. And I know that through sharing your story, you will help so many people. Thank you so much for joining me.
Thank you so much for having me.
Thank you for listening to Diary of a Kidney Warrior podcast. And don't forget that you can contact me on social media using the handle Diary of a Kidney Warrior. Please do subscribe to the podcast and please do tell a friend. New episodes of this podcast are released every other Monday. Until next time, take care and choose to live.
Diary of a Kidney Warrior, sharing faith, knowledge, hope, and love.